Hi, this is Dr. Bunny Vreeland, and I'm sitting with my friend and associate, Pat Pothier, today, and we'd like to talk today about PTSD. So, Pat, tell us what PTSD stands for.
PTSD stands for post-traumatic stress disorder, and it's something that affects anybody that's either been experienced or witnessed a traumatic event. That's an important denotation, is that some people think the only way you can get PTSD is to actually be involved in a traumatic event.
Like war.
Like war, maybe saw death, but it does involve physical or threatened harm.
Would rape
count? Rape would definitely count. You have bullying, that would count as well. But from a soldier's perspective, it's probably all war or battle symptoms. A lot of people think that PTSD is new. They actually they actually believe it started with the Iraq and Afghan wars or the Gulf Wars back in the early 90s. It's not true. They actually have documented cases that go all the way back to the Civil War. They just called it something different.
Something else, right?
Yeah, so back then they might have called it soldier's heart. You might have heard more recently it's called shell shock or battle fatigue.
Yeah.
It's definitely something that affects soldiers when in the battle time. It was re-diagnosed and recategorized back in the early 1980s, and it's now called PTSD.
And that stands again for post-traumatic
stress disorder. Yeah. It's a scary thing. It's something that affects our soldiers, both active and veterans, those that are out of the service. Today's statistics indicate that we have 22 deaths a day.
When you say deaths, what are you talking about?
I'm talking about suicides. Veterans are committing suicide at the rate of 22 a day, and this is a report that was done in 2012. Why that's so scary is the previous report was done in 2007. They reported 18 a year. 18 a year, now 22 a day.
Why do you think that's increased so dramatically?
I think what's happening is that you're getting this over time. You have veterans that are returning from war. They don't want to indicate that they have a weakness. They don't want to tell anybody they're sick. They don't want to tell anybody they're depressed or having panic attacks or all those symptoms that come up. And so what they do is they continue to work on them and they try to hide them. So one of the things that comes out of PTSD is that they continue to relive them. It's categorized in 3 different ways. They continue to relive them. Those might be nightmares, night sweats, revisiting that scene a couple of times in their head, or maybe even trying to recreate that scene in civilian life.
Wow.
So they relive it. The second category is trying to subdue it, trying to hide it. And the way they do that is through alcohol and drug abuse.
Right.
Because what they do is they take the pain and they bring it down. So they actually avoid what caused the PTSD in the first place. So they have reliving it, the nightmares, and then they try to avoid it doing alcohol and drug abuse and probably other abuses as well, gambling. You see it in outburst. You'll see it in domestic violence, anger. You'll see it come out that way. The other thing that it does is it causes a hyper-vigilance, meaning the person is always on alert. So what you have coming out of that is you have stress, because they're constantly stressed, they're constantly agitated, they're anxious. At attention is a perfect example of that. They can't sleep at night because they're listening for all the noises. So all of this, combined with the fact that they didn't want anybody to know about it, takes an accumulative effect over the years to a point where at some time during their life, and they're saying right around 25 years, is a point where people are starting to give up.
You mean 25 years after the event? Trauma. Wow. And
so that cumulative effect has gotten to a point. Then they go then they'll look for treatment. And the only 2 treatment problems out there right now, especially through the VA, is either medication, which a lot of people hate because they, avoiding the drug abuse, or counseling. And the counseling takes years. And so they're trying to really, trying to avoid that. And so what they do is they take an alternate path. And 22 a day are committing suicide.
How can we help?
We can help a number of different ways. We have a number of different treatment options that are going to become available, and I think we're going to talk about that in another segment as soon as we film that.
Yes, we are.
All right.
Thank you, Pat.
You're welcome.
Thank you for telling us about PTSD. It's hugely important. Stay tuned. This is Dr. Bunny Vreeland, Pat Pothier.
Pat Pothier. Thank you.